Good afternoon. My name is Beth Christensen. This is my health assessment video. Hi, my name is Beth. I'm a student nurse and I'll be doing your physical exam today. What's your name?
David.
And how old are you?
37.
Nice to meet you, David.
Nice to meet you.
Do you feel okay today?
I do.
Do you have any complaints?
No.
Any pain?
No.
Any recent illnesses?
No.
So here I have a well-developed 37-year-old male who appears to be of good nutrition, well-nourished, good nutrition, good hygiene status. He's a calm facial. He has a calm facial expression. His mood and affect is normal, calm, happy. He's cooperative. He has normal eye contact, and his speech is clear. No obvious physical deformities that I can see on the general exam. So David, I'd like to start the physical exam by inspecting your skin with some palpation, which means feeling as well. So I'm just going to look at his legs, feet, arms, chest, and back, as well as face. Now on the back, I do notice a few moles that are larger than normal, but they don't have irregular borders and they don't have concerning color changes. But David, I do recommend that every 6 months you keep an eye on these moles with either a dermatology check or a skin checkup at home with someone who can look at your skin. This is for preventing skin cancer. Okay?
Okay.
So I'm going to move on to an eye exam. So can you just look at me and blink your eyes? So I see that his eyes blink and move symmetrically. The external visual exam is normal. Do you have any visual complaints today?
No.
Okay. Do you wear glasses or contacts?
No.
Okay. Eyebrows are present and symmetrical bilaterally, as well as eyelids and eyelashes. Upon initial inspection, the corneas appear clear and the irises are both equal and round. So just look at my nose, and I'm going to look at the corneal light reflex, pupillary reflex here. The pupils are equally round and reactive to light and accommodation. If you look at this and far away. Yep, equal to accommodation as well. Next, I'd like to test your extraocular movements or your eye muscle movements. This checks cranial nerves 3, 4, and 6. So if you just look at this pen light, follow with your eyes, not your head. Up. Very good. Extraocular movements are intact and normal. Next, I'd like to get my Snellen chart here. So I'm going to hold this approximately 30 to 36 inches away. And I'd like you to cover up your left eye and read the lowest line that you can.
F-E-L-O-P-Z-D.
Great. Can you cover up your other eye, your right eye? Read the lowest line that you can.
F-E-L-O-P-Z-D.
Okay, great. And now with both eyes, what is the lowest line that you can read?
F-E-L-O-P-Z-D.
Very good. He appears to have intact near vision. And next I'm going to move on to an ear exam. So I'm going to inspect and palpate the pinna, the outer ears, and the tragus. Any tenderness there?
No.
I see no redness or swelling and his ears appear normal, no abnormal appearance to the ears. Now I don't have an otoscope, but if I did, I would gently insert it into the external auditory canal and I would be examining the tympanic membrane. I would expect to find clear to pearly gray, intact, no redness, and no swelling, no bulging tympanic membrane. Have you had any drainage or ear pain?
No.
Okay, very good. So a normal ear exam. Set these over here. Next, I'd like to look at your nose, mouth, and throat. So could you look up, please? And I'm just going to look inside the nose. I see no obstructions, no masses. It's mildly red and irritated. Do you have any allergies, any seasonal allergies?
I do have seasonal allergies.
Gotcha. Okay. Could you please cover one nostril and breathe through the other? Good. And the other side? Good. He breathes clearly through both nostrils. And could you open your mouth? Nice and wide. Nice and wide. I'm inspecting the teeth. I do see some fillings, but no broken or missing teeth. No evidence of dental infection. The gums are all pink, no redness, no swelling. There's no exudate to the throat. The oral mucosa is all pink, intact, and moist. Could you stick out your tongue? Good. And could you say, ah? Ah. His tonsils are present. They do not obstruct the back of the throat. Yeah, I have a normal view of the uvula. And the uvula, you can relax. The uvula does move up and down with vocalization equally. And this does test cranial nerves 9 and 10 with equal uvular movement and appearance with vocalization and throat movement. So next is a neck exam. I'm going to inspect your neck as well as palpate. I'm just feeling for any deformities, any crepitus. I'm going to feel carotid pulse one side at a time. They feel nice and equal, easy to find. I felt no crepitus or abnormalities, no masses. I'm going to just feel your trachea. Could you swallow, please? It's nice and mobile, no masses. And could you please do a neck range of motion? Could you put your chin to your chest? Could you look up? Could you look side to side over each shoulder? Good. And then ear to shoulder. Any pain with that? No. Good. Okay, that's a normal neck exam. I also didn't feel any goiters, any thyroid swelling at all. I really couldn't feel the thyroid. Let's see. Oh, I also need to palpate the lymph nodes. So I'm just going to start with the pre-auricular lymph nodes, moving back to behind the ear, post-auricular, the post-cervical, pre-cervical, temporal, submandibular, and supraclavicular. I can feel no lymph nodes. It's all nice and soft, no lumps. Any tenderness with that? No. Okay, normal lymph node exam. And moving on to your chest. So I'm going to inspect and palpate the back of the chest. So I feel no crepitus, no tenderness, no masses, no sign of injury. And could you please take a deep breath? Good. I put my fingers together and I observed equal expansion with a deep breath. So now I'd like to percuss your lungs. So I'm just going to tap gently on your back. I hear resonance. It's a little hard to hear though. He has a muscular chest wall. And now I'm just going to tap on your back, okay? This is the costovertebral angle, and I'd like to see if there's any tenderness. Any tenderness?
No.
When I do that? Good. No pain. So that's good. CVA tenderness would indicate a possible kidney infection. Now I'm going to listen to your back of your lungs. I have an electronic stethoscope which has a bell and diaphragm, so I'll be pushing on it to convert to the bell or the diaphragm. Okay, deep breaths. Very good. I could hear no adventitious sounds like crackles, wheezes, bronchi, or rales. I heard just nice whooshing, bronchovesicular lung sounds, nice clear air movement. And next I will do a anterior chest exam. So if you could just sit up nice and straight, I'm going to inspect and palpate your chest. I'm looking for any crepitus. I feel none. Any sign of injury? None. And I'm going to palpate around the mid-axillary line, fifth intercostal space. I'm looking for the apical pulse, which I can feel it a little bit. No heaves. Next, I'm going to listen to your heart. So on the second intercostal spaces, on both the right and left sternal borders, using the belly and diaphragm. As well as the third intercostal space, left sternal border. Fourth intercostal space, left sternal border. That's where I can note S1, S2 most audibly. I hear no extra sounds, no murmurs or gallops. I'm just going to listen to your apical pulse here. Very nice. Do you have any chest pain or shortness of breath? No. Okay, very good. Okay, moving on to your arms. I would like to inspect and palpate the arms. Just looking at them, they appear normal, symmetrical. Any tenderness to the joints here?
No.
The skin is warm and well perfused. His radial pulses are equal bilaterally and 2+. Could you please hold your hands like this? I'm just going to press on your nail beds and base of your fingers, checking for capillary refill. And I see brisk capillary refill of less than 2 seconds. Could you please do a range of motion of your shoulders? Kind of up and forward, up over your head, and kind of around down. I see normal shoulder range of motion. Next, I'd like to assess your abdomen. Could you please lay down? Okay, thank you. So I'm going to begin by just inspecting the abdomen. I see abdomen of normal body mass index. It appears non-distended. I can see the aortic pulsation. And next I'm going to listen to your bowel sounds, okay? I'm going to start with the right upper quadrant. Normal, active. Normal, active bowel sounds in the left upper quadrant. Normal, active bowel sounds in the left lower quadrant. And normal, active bowel sounds in the right lower quadrant. I'm going to try to listen to your aorta. So, oh yeah, I can hear it. You have good cardiac output. And next, I'm going to percuss your abdomen. I'm going to start at the right upper quadrant. This sounds kind of dull. It's what I would expect over the liver. Slightly more resonant, indicative of nice hollow bowel, not obstructed by masses. And I'm just going to start gently palpating your belly, starting with the right upper quadrant. Any pain when I press in?
No.
You're just fighting me. Any pain when I press in?
No.
pain when I press in. I think he's just scared of me tickling him. I don't think he's actually guarding. Any pain when I press in
No.
or let go? No.
No.
Okay, very good. It's a nice, soft, non-tender abdomen. And could you just continue laying down? I'm going to check your lower extremities. I'm just examining the legs. The skin is nice, warm, well perfused. Good cap refill on the toes. The the dorsalis pedis pulses are 2+ and equal bilaterally. The posterior tibial pulses are 2+ and equal bilaterally. Okay, and if you could just relax your legs, I'm going to move your leg around to test range of motion of the hip. Any pain with that?
No.
Good. Okay, very good. Normal range of motion of the hips, normal leg exam. And David, could you please sit up now? So I'm going to begin my neurologic exam, and I notice first that he can sit up using, all large muscle groups with purpose, intent, and equal appearing muscle strength, purposeful movements, no tremors, or obvious focal areas of weakness. So I'm going to use this cotton ball here. I'd like you to close your eyes and tell me where I'm touching you.
Left shoulder. Right shoulder. Left cheek. Right cheek. Right foot. Left foot. Left hand. Right hand.
Did that feel equal on both sides?
Yes.
Very good. You can open your eyes. Okay, so next, this is just check cerebellar function. So this is a supination and pronation of the hand. So just do like I'm doing. Let's switch. Very good. Let's do one more test. Let's do finger, nose, finger. So I want you to take your index finger and touch my finger. Now touch your nose. Now touch my finger. Now touch your nose. And back and forth. Very good. Let's do the other hand. Very good. Nice and normal coordination following of commands. Next, can you please take your heel of one foot and run it down the shin of your other leg? Good. And can you do that on the other side as well? Okay, very good. Now, could you just help me move this stool? I'd like to check your reflexes. Okay, thank you. And could you sit back up here? Okay, and could you just relax your arm down on your leg? I know I should hold like this, but I have trouble getting my fingers around his arm, so we're going to compromise and rest his arm on his leg, and I'm going to strike my fingers. Yep, I can feel a bicep response. But it's normally hypoactive. I don't feel any hyperreactive reflexes. Yep, I felt that bicep flex. Next, I'm going to check your patellar reflexes. Just let your legs relax and dangle down. Okay, and just a very light tap here. There we go. It was very slight, but I saw it. There we go. Very slight, but I saw it. Okay, and then the Achilles reflex, you just let your leg relax in my hand. Yep. Okay, very good. Let's see. Next, we got to do the plantar reflex. So just sort of give me your foot. I'm going to go like that along the outside. Yep. Good. Normal. Okay, next is a musculoskeletal exam. So if you could please get up and sort of walk back and forth between the door and the video camera. Okay, I'm just going to move to this side. Good. Now, could you place your heel in front of your toe, heel in front of your toe, and do heel, toe, walking. Very good. Okay, and could you stop there, and could you stand up and just close your eyes? Very good. You can open your eyes. Did you feel any dizziness with that?
No.
Okay, very good. Next, I would like you to just kind of touch your toes as you're able. Bend over. Good. Any difficulty with that?
No.
And could you just sort of bend back and look up? Any difficulty with that?
No.
Okay. Thank you so much. You have a normal physical exam. Have a great day.
Thank you.
Thank you.